your belly, your hands, your eyes are not just parts of your body, but one of the main ways your body communicates with you. Today, I'm going to show you 9 signs of a fatty liver that you can see with your own eyes. Sign 1. Prominent veins on the belly. One of the most alarming signs is the appearance of enlarged veins across the abdomen. These are called Caput Medusae, named after the Medusa of Greek mythology, because the veins radiate outward like snakes from a central point. They're a classic sign of something called portal hypertension, elevated pressure inside the portal vein, the main pathway that carries blood from the intestines to the liver. Here's what happens. A healthy liver is soft and spongy. Blood flows through it easily, but when the liver becomes fatty and inflamed, it starts to harden and eventually forms scar tissue in a process called fibrosis. A stiff, scarred liver is like trying to pump water through a clogged pipe. The pressure builds. Blood can't flow through normally, so the body does something clever and alarming. It reroutes blood through smaller alternative veins that weren't designed to handle that kind of pressure. Those veins dilate. They become visible under the skin of the belly. This is not a normal variation. This is your circulatory system sending out a distress signal. If you see this, you need medical attention. Sign 2. Yellow eyes. One of the clearest warning signs of liver dysfunction appears in the whites of the eyes, a yellowing called jaundice, and it's one of the most telling signs of liver trouble. Every day, your body breaks down old red blood cells. That process produces a yellow pigment called bilirubin. Normally, the liver takes that bilirubin, processes it, and passes it into bile for the digestive system. That's why stool is brown. It's bilirubin being excreted. But when the liver is bogged down by fat and inflammation, it can't keep up. Bilirubin starts building up in the blood. And since bilirubin is literally yellow, it begins depositing in tissues, most visibly in the whites of the eyes. Why the eyes first? The sclera has a high affinity for bilirubin. It absorbs it faster than other tissues. If you're not sure whether your eyes look yellow, try this. Compare the whites of your eyes to a sheet of white paper in natural light. Any color difference is worth noting. Sign 3. A severely bloated belly, even if the rest of your body is lean. This is one of the most misunderstood signs. People often chalk it up to bloating, gas, or just getting older. But there's a specific type of abdominal swelling that's entirely different. It's called ascites. Ascites is the buildup of fluid inside the abdominal cavity. We're not talking about a little bloating after a big meal. We're talking about liters of fluid accumulating in the space between your organs. Here's why it happens. When the liver is damaged, it produces less albumin, a protein that helps keep fluid inside your blood vessels. Without enough albumin, fluid leaks out of the vessels and pools in the belly. Combined with portal hypertension, the result can be a dramatically distended abdomen. Quick self-test. Lie flat on your back. Does your belly fall naturally to the sides like a water balloon? Tap one side of your belly while your other hand lies flat on the opposite side. Do you feel a wave of fluid rippling across? That's the classic test for ascites, a hard, tight, rounded belly that won't go down, especially alongside other signs on this list, is something to take seriously. Sign 4. Unusually red palms, especially along the outer edges. One of the stranger signs of liver dysfunction can show up in your hands, where the palms turn noticeably red. This is called Palmar erythema, and it's a well-documented sign of chronic liver disease. The reason comes down to estrogen. The liver is responsible for breaking down and clearing excess estrogen from the blood. When the liver is damaged and can't do this, estrogen levels rise. And elevated estrogen causes tiny blood vessels, capillaries, to dilate, especially in the palms. The result is that characteristic redness. Palmar erythema can have other causes: pregnancy, rheumatoid arthritis, thyroid issues. But if you notice it alongside other signs on this list, the liver should be on your radar. Sign 5. Tiny spider-like red vessels on the chest, shoulders, or arms. People with liver dysfunction sometimes develop small spider web-like blood vessels on the upper body. These are called spider angiomas, and they're created by the same mechanism as red palms: excess estrogen, dilating tiny vessels near the skin's surface. Here's an interesting nuance. It's completely normal to have 1 or 2. Most healthy adults have a few. But when you start seeing 5, 6, 7 or more, especially concentrated on the upper body, that becomes clinically significant. Doctors use the number and distribution of these angiomas as one of the tools to assess liver function. The more you have and the larger they are, the greater the concern. Sign 6. Yellowing of the skin, not just the eyes. The same bilirubin process we discussed in the eyes, but now visible across larger areas of the body. The forehead, palms, soles of the feet, and torso are often the first areas where skin jaundice appears. It can be subtle. Sometimes it just looks like a very deep tan, or that your skin is off without any obvious reason. Check the soles of your feet in natural light. The yellow tone is often easier to spot there. One important distinction: yellowing only in the palms and soles without affecting the eyes may be carotenemia, from eating large amounts of carrots or sweet potatoes. That's harmless. But if both the eyes and skin are yellow, bilirubin buildup from the liver is far more likely. Sign 7. Severely swollen legs, ankles, or feet. Here's a test I want you to do right now. Press your thumb firmly on the front of your lower shin, right against the bone, and hold it for 5 seconds. Then, release and watch. Does an indentation remain that takes a few seconds to fill back in? If so, that's called pitting edema. And with a fatty or damaged liver, it happens for the same reason as ascites. Low albumin levels cause fluid to leak from the blood vessels and pool in the tissues. And because of gravity, that fluid sinks, accumulating in the legs, ankles, and feet by the end of the day. You might notice your shoes feeling tight in the afternoon, or your socks leaving deep marks around your ankles. You might wake up with normal-looking legs, but by night they feel like they belong to someone else. Swollen legs have many causes: heart failure, kidney disease, standing all day. But combined with the other signs in this video, puffy legs become an important clue. Sign 8. Bruising easily, without any real injury. The liver produces most of the clotting factors your blood needs to stop bleeding. When the liver is damaged, it produces fewer of these proteins. The result? Blood simply doesn't clot as well as it should. How this shows up in real life: you brush your arm against a corner and wake up the next morning with a deep purple bruise. You scratch yourself lightly, and it leaves a mark that lasts for weeks. You bump into something, and the bruise is wildly out of proportion to the impact. Some people notice it first on their forearms or shins, areas that take small hits throughout the day. Others see it on their thighs or belly. A good way to assess: look at your arms and legs right now. Count the bruises. Do you know how each one got there? If you're finding bruises without remembering how, that's worth paying attention to. Sign 9. Completely white or abnormally pale nails. Hold your hands out and look at your nails. Healthy nails have a pinkish tone because the nail plate is translucent. You can see the blood-rich tissue underneath. Now, if your nails look white, pale, or washed out, especially if the lower 2/3 of the nail are white and the upper third has a narrow pink or brownish band, that's called Terry's nails. Terry's nails were first described in patients with liver cirrhosis, and the leading theory is that they're caused by a combination of low albumin levels and reduced blood flow to the nail bed, both direct consequences of liver damage. The whitening happens because the connective tissue beneath the nail thickens and the capillaries become compressed. Less visible blood means less visible pink color. Not every pale nail signals liver disease. Anemia can also cause this, but Terry's nails have a very specific appearance. That thin, darker band at the tip of the nail is the key detail. Now, the truth: having one of these signs doesn't automatically mean your liver is failing. Some may have other explanations in isolation. But if you've watched this and kept thinking, "I have that, and maybe that one too," that pattern matters. The most dangerous thing about fatty liver disease is that it's completely reversible in the early stages. The liver is one of the few organs in the body that can regenerate, but only if you catch the problem before it progresses to advanced scarring. The two biggest culprits: sugar and processed carbohydrates, not just alcohol. Non-alcoholic fatty liver disease is now more common than the alcoholic kind. Fructose specifically is metabolized almost entirely in the liver, and in excess, it's converted directly into fat. High fructose corn syrup, sweetened beverages, processed snacks, these are doing to your liver what most people only associate with alcohol. The second major factor is insulin resistance. If your body has stopped responding well to insulin, the liver defaults to storing fat. The good news: lifestyle changes, cutting sugar, improving sleep, moving more, losing even 5 to 10% of body weight, can dramatically reverse early-stage fatty liver. We're talking about measurable improvements in liver enzymes within just a few weeks. But you have to start somewhere. And that somewhere is recognizing the signs.